As parents, there is no greater gift than that of the lives of our children. From the moment we first lay eyes on them, we become justifiably obsessed with tending to their every need and keeping them safe from harm. There are many obvious needs that we provide for our children, such as proper nutrition, food, and clothing, but the greatest gift we can give them is immunization from preventable disease. These are the faces of children who have been stricken with communicable diseases. These are the faces of smallpox, pertussis, mumps, polio, diphtheria, tetanus, varicella, and rubella. These children were not immunized. Great strides have been made towards elimination of these diseases and others, but without vaccination, many more will die unnecessarily. Prior to vaccinations, diseases like pertussis, polio, measles, rubella, and influenza affected hundreds of thousands of children each year, and thousands died. In 1921 alone, 15,000 Americans died from an outbreak of diphtheria. A rubella outbreak in 1964 and 65 killed 2,000 babies and caused 11,000 miscarriages. Immunizations have been described as the single most important public health measure of the 20th century. Yet still, many children with abundant access to these life-saving medications go unvaccinated. Much information is available both for and against the practice of vaccination, from both reliable and unreliable sources. The information in this presentation is endorsed by the Centers for Disease Control and Prevention, the United Nations Children's Fund, the World Health Organization, the American Association of Family Physicians, and the American Academy of Pediatrics. This presentation is offered to you as a means of obtaining accurate and up-to-date information about the benefits of vaccines to help you make better informed decisions regarding your child's healthcare needs. Over the past few years, many have questioned the need for vaccines, and many more have reservations about giving them to their children. These are the facts as we know them. First, let's look at some common misconceptions regarding childhood immunizations. It has been said that vaccines actually cause diseases and have many awful side effects. The fact is that vaccines are very safe, and most side effects are limited to a brief mild fever or soreness at the injection site. Vaccines cause autism. There have been no reputable studies indicating any correlation between vaccines and autism spectrum disorders. The one case you may be familiar with reported a link between the two. It was later found to be conducted using intentionally falsified data. The doctor who published the study has since lost his license to practice medicine. I have never known anyone with any of these diseases, so I don't really need to have my child immunized. One major reason most of us have never seen these diseases is due to the success we have achieved thus far directly through vaccinations. But these diseases do still exist, and the only way to completely eliminate them is to vaccinate. 90% of measles cases are associated with cases brought in from other countries. With the ease and frequency of global travel in our society, the next outbreak could be only a plane ride away. The latest statistics by the World Health Organization are a stark reminder that we still have a long way to go. In 2014, there were 114,900 measles deaths globally, about 314 deaths every day, or 13 deaths every hour. In 2014, 7,321 cases of diphtheria were reported to the World Health Organization, but there are likely many more. Worldwide, it is estimated that there are 16 million pertussis cases and about 195,000 pertussis deaths in children every year. On the bright side, the CDC estimates that vaccines given to infants and young children over the past 2 decades will prevent 322 million illnesses, 21 million hospitalizations, and 732,000 deaths over the course of their lifetimes. So, what is the next step? The list of vaccinations can be very long and a bit hard to understand. Timing, frequency, and accurate records are essential to ensuring that your child is kept up to date. The Centers for Disease Control recommends immunizations for 14 preventable childhood diseases. The CDC provides easy-to-follow charts listing what vaccines are recommended and when they should be received. This and other information can be downloaded from their website. Your doctor or the county health department also have this information available. When your child is vaccinated, you will receive a vaccine information sheet with the latest up-to-date information regarding the vaccine, as well as symptoms of the diseases covered and potential side effects. These are intended to be straightforward and easy to understand, but feel free to ask your doctor, nurse, or healthcare professional to clarify any or all of the information. We are making many positive strides toward total eradication of childhood diseases. Today, most doctors in the United States have never even seen a case of the measles. Only one case of diphtheria in the United States has been reported to the CDC since 2004. And perhaps our greatest achievement to date, smallpox was officially declared eradicated from the world in 1979 and therefore no longer requires vaccination. Ultimately, the decision is up to us as parents to keep our children safe. A few moments of discomfort could prevent a lifetime of heartache. With continued effort by parents and healthcare providers, we will reach this goal, so we will never again have to endure these images of our children, but can instead look forward to these.